when it comes to topical medical issues, where we engage with specialists from the various fields of medicine to share with us accurate, updated information on the topical medical issue. Today we have an amazing senior specialist gynecologist who's going to take us on the journey to understand more about family planning. Which of the methods do you know of? Which ones do you use? Are there side effects? How do you go about it? What should you do? Please, today, we have a senior brother, a friend. He's Dr. David Wilfred Parker Alote. He's going to take us on the topic family planning. Please, all your questions, hold on. When he's done, he's going to have time to answer all your questions. Senior, over to you.
Okay, thank you very much, Dr. Albert. Sado here. Thanks for the introduction. If you can hear me, just type hello, so I know you can all hear me. If you can hear me, just type hello in the chat box, so I know you can all hear me. Just type hello in the chat box if you can hear me. Sound and clear, good. Okay, all right, that's fine. Okay, so today we are just going to talk briefly about family planning. The methods are diverse, there are lots, but I'll try and go through quickly. I'll take more time on the most common ones that we use here, and then the ones which are less common, I'll just brush over it so that I have more time to explain the common ones. Okay, so basically, let's start by defining what family planning is. Whenever we hear family planning, people only think that family planning is about preventing pregnancy. All right, that's a mistake people think. People think that family planning is only about preventing pregnancy, and that's one of the misinformations we have. Okay, so family planning actually allows individuals to anticipate and attain their desired number of children in the spacing after birth, okay, by using contraceptive methods. All right, it also allows you to get pregnant. So family planning allows you to get pregnant when you want to get pregnant and prevent you from getting pregnant when you want to get pregnant and when you don't want to get pregnant. Okay, so it's not just about preventing pregnancy, it's giving you the power to space your children, to decide how many children you want, and etc. You know, times are hard now. You can't just give birth to as many as you want. All right, you have things difficult, and we also have what we call contraception. Okay, which is also something different. Contraception is the intentional prevention of pregnancy by artificial or natural means. So that's the difference between family planning. Family planning is the ability to have kids when you want to plan your spacing, etc. But contraception is mainly about preventing pregnancy intentionally. So contraception is like a subset of family planning. Okay. So what are the benefits of family planning? And this is a very important slide. Okay. Benefits of family planning is a lot. It doesn't just affect the couple. Sorry. Okay, so family planning doesn't just affect the couple, but from here you can see that it affects the woman, and I believe most of us here are women. It affects the woman, it affects the children, the community, the family, and the country as a whole, all right? So how does it affect the woman? It reduces maternal death, all right? We are still living in a part of the world where a lot of women still die during childbirth. Okay, maybe not really happening that much in Accra, but Ghana is not just Accra. Okay, and a lot of women are dying through childbirth. And most of these women, if they had access to family planning, they wouldn't have died. Okay, it also benefits the children because when you space a time interval between the birth of your children, you're able to take better care of them. You're able to feed them better. All right. It reduces infants' mortality. All right. And children who die under 5. But when the space is too much, you can't take better care of them. You can't feed them well. They don't grow well to attain their highest potential. Okay. And for the family, it's improved the quality of life. All right. Somebody who has 2 kids, when they want to have 2 kids, so somebody who has 7 kids, I mean, of course, one who has fewer kids and a smaller family can feed them better, all right, can afford to take them to better school, can afford to live in a better community. But when you have so many kids, of course, all your resources going into buying stuff for the kids, diapers, pampers, school fees, you have little money on you to help improve the quality of your life. Of course, and it helps the nation as a whole and the earth less demand on natural resources. So what is the ideal contraceptive? In fact, no, we don't have any ideal contraceptive. Medicine is trying so hard to find the ideal contraceptive, but the ideal contraceptive have to have all these characteristics. It has to be safe, no side effects. I'm sure a lot of you would ask me questions about side effects you had when you use a particular contraceptive. Okay, the ideal contraceptive will be 100% effective. But one thing you should all know from here is that no contraceptive is 100%. Even with perfect use, no contraceptive is 100%. All right, there's always a failure rate. And ideal contraceptive should be easily accessible. You should have it anytime you want. All right, you should be able to walk in a hospital anytime you want. But we realize that there are some contraceptives which are easily accessible. There are some which are not, and it should be acceptable to all. And we know that most of the contraceptives are not acceptable to all based on your religion that you are in. It should be affordable, which is not the case in most of them, and it should be reversible and not coitus dependent. And that not coitus dependent is very, very important. When we say contraceptive is coitus dependent, it means when you're going to have sex, you have to have the contraceptive, like condom is coitus dependent. Okay, if you don't, you need it, so it interferes with coitus. Okay, but there's some that it doesn't depend on coitus, like the implant. You've used it, you don't need it anytime you're going to have sex. All right, so you can see that these are the characteristics of the ideal contraceptive, but no contraceptive has all these wonderful characteristics. So in choosing a correct contraceptive, you have to weigh the risks versus benefit, how it favors you, how it works with your lifestyle, your age, and etc., etc. Okay, so what are the methods of contraceptive? And these are the way I'll group them as we go through to talk about them. It makes it easy when we classify them. So we have the natural, artificial, which we normally say they're the modern. And when we have the hormonal and non-hormonal, okay, we talk about them, reversible and non-reversible. That's our contraceptive. When you use it as that, you can't reverse it. All right. Sometimes this week, some women contact me. Oh, I did this contraceptive, which is non-reversible. It's a permanent one, and then she wants to reverse it. It's not possible. Okay, temporal or permanent, and then long-acting reversible. Okay, so we'll talk about all this as we go on. Okay, so we'll start by talking about the long-acting reversible contraceptives. Okay, what we mean by long-acting reversible is it's when you use it, it lasts for a number of years, for so many years, all right? You can see some of them last for 10 years, some of them last for 5 years, okay? We'll go into detail. So when we say they are long-acting, okay? You don't have to change it so quickly. So it's ideal for a woman who doesn't plan on giving birth within the next 5 years, all right? But she's in a sexual, she's very sexually active, whether married or non-married, but she doesn't plan on giving birth anytime soon. So then these kind are very, very safe for you, ideal for you, okay, because it's reversible as well. And then we have the barrier methods. The modern methods are the barrier method that we all know, hormonal, the IUD, sterilization, emergency contraceptive. We'll go through all this, okay? This is just the introduction as we go on. Now, look at this slide very, very carefully and remember it throughout the presentation. It's talk about the failure rate of contraceptives, okay? Some contraceptives have a very low failure rate. That means they are very, very safe. Their failure rate is very low. And let's look from the bottom of the graph. You see the Norplant, the Depo-Provera. I'll talk about all the female sterilization, the IUD. You can see the failure rate is very, very low. The yellow line, the yellow mark is perfect use, okay? That means the person is using it correctly and consistently. Okay, a lot of people use contraceptives, but they don't use it correctly and consistently. Like somebody taking the pills, the daily pills. Today they take it, tomorrow they forget to take it, the next day they forget to take it, then they remember, then they take it. All right, or you're using condom, today you use it, tomorrow you don't use it, all right? That is what we call the typical use, okay? And that's what most people do, all right? So you can see that with those below, the typical use and the perfect use are basically the same, because as I said, they are not sex dependent. Once it's there, it's there, all right? Like the Norplant, which is an implant, the Depo-Provera is an injection, the sterilization in which the woman's tube has been tied, or the IUD, all right? The perfect and the typical use are basically the same, and they have the best protection, all right? The failure rate is very, very low. But then when you get from the COC means combined oral contraceptives. The combined oral contraceptives, the condom, the diaphragm, the periodic abstinence, where you feel you're not in your safe period, so you abstain. Those, so I will talk deeply about it. You can see there's a big difference between the typical use and then the perfect use, all right? Because it's sex dependent. It depends on you using it every day, and people fail to use it sometimes and they don't use it. So the failure rate in those ones are very, very high. All right. So if you are using any of those contraceptives, you should know that the failure rate is higher if you do not use it correctly. And it's the same thing over here. All right. All right. So I'll go into it. Now let's talk about the male condom. All right, the barrier method. We talk about the male condom. That is one of the commonest forms of contraceptive that most people know and most people use. But this is the only contraceptive, the male and female condom are the only contraceptive method. In fact, the male condom is the only contraceptive method which is said to be a dual contraceptive. All right, it serves two purposes. Apart from preventing pregnancy, it protects you against sexually transmitted infections and HIV. All right, that is the biggest plus of this, and that's the only contraceptive which has that dual purpose. Okay, and most people know about it. It is, of course, sex dependent, and it has certain side effects which are like irritation for some few group of people who say they are sensitive or they are allergic to latex. All right, so for those people, it becomes difficult for them to use. But we have male condoms which are not latex. Okay, they are not made of latex. So that is the alternative for such people. All right. And one thing we should remember is that when we use the latex condom, we should be sure of the kind of lubricants we use. Okay, it uses only water-based lubricants. All right. Some people use lubricants which may destroy it, but it uses only water-based lubricants. All right. And as I said, there's a natural membrane and then the plastic polyurethane, which are non-latex, are good for people who have latex allergy. Okay. These ones are not really common, but you may want to ask from one of the big pharmacies if they have non-latex condom. All right. Because remember, it is the only one that protects you against STI, which is very, very important and is very effective at doing that. All right, so some condoms are lubricated with spermicides. Okay, there's a few condoms that are lubricated with spermicides. Spermicides are compounds that kill sperms. Okay, so There are some condoms which are lubricated with spermicides. And the failure rates, when you use it perfectly, is 3%. So just remember that even though you are using the condom perfectly, you are wearing it perfectly, you are doing everything that you have to do when it comes to it, it's still not 100%, okay? There's a failure rate of what? 3%. So sometimes a guy shouldn't think that, oh, when the lady says, I got pregnant, even though we use condom, and the guy shouldn't go all around saying, no, it's not possible, because it's not 100%. But the typical use failure rate is 14%. Typical use is when people don't use it well. You use it on and off. You are not consistent. You don't put it on well. You don't remove it well. There are leakages. It breaks. Okay. The failure rate is higher, 14%. So reasons why condoms fail. Failure to use a condom with every act of intercourse. All right. So sometimes the couple uses it and they don't use it. They don't use it. They don't use it. Of course, it's going to fail you. Failure to through the intercourse. So some couples start the sex without a condom. And then when the man feels he's about to ejaculate, that is where he wears the condom. Remember, there's always a pre-cum, right? Sometimes the man may release a little bit before he even has the sensation that he's going to ejaculate. And now that little semen that comes is highly concentrated with sperm. It is the most concentrated with sperm. That little semen that comes, that sometimes the man doesn't even feel it coming, all right? And it happens. If you're a lady, I'm sure there are times that you are playing with your man's penis and then you feel something slimy come out of the tip, all right? You wouldn't say it's come, but something has come out. And that little thing contains a lot of sperm, so you know what I'm talking about. Improper lubricants used with latest condom. I said it uses water-based lubricant. So if you are using lubricant to, maybe the lady doesn't get wet enough, so you have to use lubricant, and you're using a wrong lubricant, it may destroy the condom. And then you don't place it well. Right? When you're wearing the condom, you have to hold the tip where otherwise air bubble will go there and it can easily rupture. So you have to hold the tip before you roll it onto the erect penis. You have to wear it when the penis is erected. You don't wear it on the penis which is not erected. It won't work well. And then poor withdrawal technique. All right. When you have sex with the condom and you ejaculate, when you're coming out of the vagina, you have to hold the base of the condom. All right. You have to hold it to the penis and pull out. If you just pull out your penis, you pull out and the condom will be left in the vagina. I've had a number of cases like that where a lady comes to me, they say after sex, they can't find the condom. Where is the condom? It's deep in the vagina because the guy didn't hold onto it while she tried. Because at that time, when you come, the whole thing is slippery, okay? So it doesn't come, and then of course, semen will leak into the vagina and the lady will get pregnant. Okay, so these are the reasons why condoms fail. Now the female condom too is there. It's not very popular, all right, but it's also there. It's also another form of condom. And the good thing about the female condom, which you should notice, that it can be inserted up to 8 hours before intercourse. So you, the lady, are going to visit your partner or something, and you know definitely something is going to happen. All right, you can wear it before you even go. All right, because you can wear it up to 8 hours. Not like the male condom where the penis must be erected before. All right, and you shouldn't use the male and the female condom together. All right, it's rather going to cause problem. All right, so that's the important thing to know about the female condom. All right, the failure rate is equal, just about the same as the male condom. Major advantage is that the woman is in control of it. All right, so you know the partner doesn't like condoms, and he's never ever going to buy the male condom. So you are in control this time. So you buy it and you insert it, and then we are in control. It also helps prevent STDs as well. Now the diaphragm, these ones are not so common, but just for education purpose too, is a dome-shaped rubber cap, all right, which is inserted in the vagina before intercourse, okay? It comes in various sizes, okay? So the dome of the diaphragm covers the cervix, so it's a dome, a dome. Okay, so the dome covers the cervix. You know that the sperms need to enter the cervix, okay, to be able to go and do what they have to do. So of course, as far as it covered the whole of the cervix, the sperms are not able to pass there, okay. And so that's how I think. Once in position, it can be there for, it provides effective contraception for 6 hours, all right? So you can go for multiple rounds with it. And then after intercourse, it must be left in place for at least 6 hours. You don't remove it immediately like the pill condom, or you get it. Because it has spermicide, so you need it to be there for some time. But don't keep it for more than 24 hours. Otherwise, it can lead to certain problems, something called toxic shock syndrome due to infections, okay? So that's the thing about the diaphragm. And then we have the cervical cup also, okay? It's also inserted in the vagina, and it also protects for 48 hours. And you can have sex so many times as far as you are wearing it, but do not wear it for more than 48 hours, okay? So these ones are not so popular, so that's why I'm not keeping so long on them. And then we have the sponge also, the contraceptive sponge. So as the name implies, it's like a sponge which has spermicides in it, okay, and it protects for 24 hours. And the advantage of these ones, the cap, the cervical contraceptive sponge, is that you can use it, you can have sex multiple times, all right, whilst it's in place, okay? You don't have to change it after each round of sex, okay? So that's the advantage. But always remember that for most of these ones, you do not want to leave it in place for longer, okay? You have to remove it most of the time. Don't forget and leave it in place because it may cause problems. And then we have the spermicides too, as well. These are chemicals which kills the sperms, okay? And you rub it in the vagina before sex, all right? And it's supposed to kill the sperms. And then, of course, some condoms have spermicides in them. The sponge too has spermicides in them, okay? Of course, because we are using a chemical which can be irritating, that's why they say you have to wait for some time before you have sex. And if you have sex after 2 hours, you have to reapply again. Okay, so as I said, these ones are not so common. Now, let's go to the more common ones, like the IUD. Okay, that's an intrauterine device. Okay, this is one of what we call the long-acting reversible. Okay, long-acting. So it can be used for so many years, and it's reversible. When you don't want to use it, when you want to get pregnant, you can remove it and then you get pregnant. Okay, so we have 2 types of the IUD, and I'll go through as well. Okay, so we have the copper IUD. The copper IUD, you see the IUD comes, this is the picture of it, it's a T-shape, all right, it's T-shape, and then it has copper wound around it, all right, and that's why we call it copper IUD, okay. So it's just a flexible material, flexible plastic material with copper wire wound around it. And see the failure rate. The failure rate is less than 1 in 100, okay, which is very, very good, right? Extremely, one of the extremely forms of contraceptive. And as I said, it can last as long as 10 to 12 years. That's how long it lasts, all right, which is very, very good. The very good thing about it. And as soon as you remove it, you'll get pregnant when you want to get pregnant. All right, so this picture shows IUD in the uterus. So when we insert it, there's a small rope or thread that will be left in the upper part of the vagina, so that from time to time, the woman can feel it to make sure that it hasn't fallen out, okay, and it's still in place. All right, but it doesn't interfere with sex at all. It doesn't interfere with sex. So how does it work? It mainly prevents fertilization, all right, by killing the sperms, all right. The copper and things is toxic to the sperms, all right. So It kills the sperms and it doesn't make the inside of the womb, what we call the endometrium, grow very well for even implantation to occur. All right. So, and it interfere with the movement of the sperm, because where the sperm is going to move through to get into the tubes, and the copper IUD is there. So that is basically how it prevents pregnancy. It does not cause abortion, all right? It doesn't cause abortion at all. So keep that in mind. It prevents fertilization from happening. Now, what are the side effects? Now, this is where I know a lot of people will be interested, because a lot of people who are on IUD always complain about these things. And the problem is that sometimes, maybe when they went for the family planning service, they didn't really explain all these things to them, all right? And so they complain. Now, change in the menstrual pattern for the first 3 months, all right? And this is it's something that every lady should know, all right? So that they don't get worried. Okay, your pattern may change for the first 3 to 6 months, and normally we are not worried. We normally say that this is expected. After 3 to 6 months, most of the things return to normal. Okay, so that is a very, very important piece of information. All right, and then of course, for a woman who has PID or has a vaginal infection, I mean, with symptoms, we wouldn't want to insert the IUD. We want to treat her before we insert the IUD. Okay, and but the IUD can be inserted right even after we do an abortion. Of course, unless the abortion is complicated by an infection, but it can be inserted right after an abortion, and you are good to go. And then we have another kind of IUD, which we call the Mirena. All right. This one doesn't have copper. It has hormones, okay, called levonorgestrel. It has a hormone, all right. It's very, very effective as well, extremely effective. This one normally has a 5-year lifespan. The copper IUD has like 10 to 12 years. This one has a 5-year lifespan. So it has a hormone on it, which is releases every day. Just a little bit is released every day, okay. And that is how it prevents pregnancy. And remember, see the failure rate to 1 in 100. Very, very 2 women out of 1,000 women who are using Mirena, only 2 will get pregnant. All right. So it's very, 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 very effective. And it also has some benefits which we call non-contraceptive benefit. That means sometimes when women are having heavy menses, all right, we put in the Mirena for them as well. When their menses is very, very heavy, they bleed a lot with so much cramps. And so we use it. That one we are not using for contraceptive, we are using for its non-contraceptive benefits. Okay, so that's the picture of the Mirena and how it looks. And as I said, it has a 5-year lifespan. There's another type that has a 1-year lifespan. Okay, there are different types. So how does the Mirena prevent pregnancy? That's the IUD, the hormones. Okay, so because of the hormone progesterone, that is the levonorgestrel, it prevents pregnancy by thickening the cervical mucus. All right, you know the sperms passes through the cervix, but the cervix has mucus there, so it thickens that mucus, so sperms cannot penetrate to enter. Okay, so it inhibits the motility and the movement of the sperms. Okay, and then the endometrium to the lining of the womb that grows every month is prevented from growing. Okay, and then sometimes it also even prevents ovulation, not always, but sometimes it prevents ovulation. Now, this is a very important point, that because sometimes the women who are using this Mirena do not have their menses at all right? And so that shouldn't be a worry to you as well, okay? This is an important information because sometimes it prevents ovulation, okay? But if you are using the Mirena and you have your menses, a lot of women have their menses normally. If you have your menses, then suddenly you realize that you are not having your menses, you should do a pregnancy test, okay? But most of them, some women do not have their menses, and it is normal with it. As soon as you remove your menses, you resume. Okay, so as I said, the IUD, the good thing about it that it can be inserted any time during your menstrual cycle. So far as you are sure that you are not pregnant and you don't have any vaginal infection, all right, it can be inserted, okay? And then even just after an abortion, it can be inserted, okay, just after an abortion, especially when the abortion is an early one, first trimester abortion, it can be inserted. And after delivery, we can insert it immediately within 48 hours. If you had a cesarean section or vaginal, you can insert it immediately, okay? And remember, it can be used as an emergency contraceptive. I'll talk about it as we go, but it can also be used as an emergency contraceptive if you insert it within 5 days or up to 5 days after unprotected sex. Okay, I'll talk about emergency contraceptive, but the IUD is the most effective form of emergency contraceptive. So there are some myths about IUD that I'm sure a lot of the women here probably are aware of, and that's that's what makes them not want to use the IUD. All right, there are a lot of myths about this. These are some of the myths. Some people think that the IUD will migrate, like you put it in your womb and it will find itself as some other part of your body. That is not true. They think that it causes infection. It doesn't cause infection. They feel it will prevent you from getting pregnant in the future. No. Return to fertility is immediate. And I'll talk about what I mean by return to fertility. In fact, let me talk about it now. There are some of the contraceptive methods when you use, you do not, and you stop using it, you do not start ovulating immediately. It can take so long before you start ovulating, especially the injectable like Depo-Provera, which I'll get to. Okay, the one that the women take every 3 months is quite popular. But what sometimes a lot of women are not told is that when you stop using it, you may not be able to, you won't start ovulating immediately. It can take as much as 18 months to return to fertility. Okay, so that's something to be aware of. But with the IUD, return to fertility is immediate. And it does not cause ectopic pregnancy. Okay, it does not cause ectopic pregnancy. So these are some facts about the IUD that we should all be aware of. Now let's talk about the hormonal ones. Okay, that's also very, very common one. The hormonal ones, when we say the hormonal ones, it means it contains hormones, like the Mirena, which I just talked about, is a hormonal form of the IUD, all right? Or like the copper IUD. So the hormonal ones are the pills, like the combined pills. We have two types. We have the combined pills, which means it contains two hormones, it contains estrogen and progesterone, okay? And then we have the mini pill, which is only progesterone. It contains only progesterone, okay? Yeah, so the pills, you basically have to take it every day, once every day. You do not have to miss it. When you miss it, the effectiveness is reduced, okay? So you take the pills every single day, and then there's normally you take it every day for 21 days, and then there's a pill-free period where you bleed, okay? And then you continue with the next pack. Now we have the progesterone only pill. The disadvantage is that you have to take it at the same time every day. You can't, if you're taking it at 7 a.m. every day, you have to take it at 7 a.m. every day. You can't take it 7 a.m. today, then 5 a.m., then 10 a.m. It doesn't work. Okay, you have to take it at the same time. Okay, but the combined pills, you just have to take it every day, all right? And then we have the implants. I'll get back to it. The injectables, the patch, the vaginal ring, the hormonal ring. So these are the hormonal ones. So let's talk about how do the hormonal ones work. The hormonal ones work because they contain hormones. They inhibit ovulation. Okay, they prevent you from ovulating. So you do not ovulate at all. Okay, it's also taking the cervical mucus. It makes the endometrium unfavorable for implantation. So in case there's even fertilization, there won't be implantation. Okay, so that's basically their mechanism of action. So as I said, we have the oral contraceptive pills, that we have the combined oral contraceptive, which contains estradiol and progesterone. Okay. So the popular one we have here is the 21 pills. Okay, so 21 of them are active, they contain the hormones. And the last 7 contain just iron, okay, so that you take it whilst you're taking it, you bleeding. It must be taken daily, and it's 92 to 99% effective, all right, which is good. It must be taken daily. You cannot be missing it. And then the mini pill, that I said, is the progesterone only pills. You have to take it at the same time every day, okay? The advantage is that lactating mothers or women who are breastfeeding can use the progesterone only pill. We don't normally like breastfeeding mothers to take the combined oral pills, okay? So the breastfeeding mothers can take it. So sometimes women ask, oh, you're breastfeeding, can you take the contraceptive pills? You can't take the combined, I can take this one, the progesterone only pills. Okay, because remember, breastfeeding mother can also get pregnant, and it happens a lot. If you are breastfeeding and they are not breastfeeding adequately, then the baby is not exclusively breast milk, the baby is on other feed, you are most likely going to start ovulating and you can get pregnant. The thing is that most women will also think, most breastfeeding mothers think that I can get pregnant after I start having my menses. Do you realize it? But remember, before you have your menses, it means you have ovulated that month. So before you realize you are pregnant, there are a lot of women, they are breastfeeding, their menses is not coming. They think it's because they are breastfeeding, but they are pregnant before they realize they are 3 months, they are 4 months pregnant. Because before your first menses will come, you would have ovulated. And so if you're having sex at that time, you can get pregnant. I hope we understand this point. Very, very important. All right. Of course, the side effect is the changes. You can just change the menstrual patterns. Okay. Your bleeding patterns can change. All right. So these are things you should be aware of. When it happens, you just talk to a gynecologist or the family planning clinic, and they will know what to do. Okay. And the pills do have what we call a non-contraceptive benefit. We use it for other things apart from contraceptives. Okay, like a woman who bleeds heavily during her menses, we use it. Okay, and remember the pill also decreases your chances of getting certain cancers like ovarian cancer and endometrial cancer. Okay, and the protection can last for 30 years from the time you stop using it. Okay. But of course, you should have used it for a long time for you to get this protection. Okay, for ovarian cancer, you should have used it for 5 years. For endometrial cancer, you should have used it for at least 1 year. Okay, and it protects you from these cancers. So these are some of the non-contraceptive benefits. Okay, and of course, it helps reduce acne in women as well who have a lot of acne, especially the ladies with polycystic ovarian syndrome. And we also use it to regulate the menses. And women, their menstrual cycle becomes very, very irregular. We use it sometimes to regulate it. So these are what we call the non-contraceptive benefits of the pill. Now, the some of the hormonals are the vaginal rings, like which is a flexible ring containing progesterone and estrogen. It's placed in the vagina, and you keep it for 3 weeks. This one is very, very effective. You just place it for 3 weeks and you remove it after 3 weeks, and so the 4th week so that you can bleed. All right, and then we have the patch too. It's a flexible plastic containing estrogen and progesterone, which is worn every week. You just put it on your skin as a patch, and you use it for 3 weeks, and remove it on the 4th week to have your menses, and then you place another one there. So those are the vaginal ring and the combined patch. So you can see that there's so much choices when it comes to family planning. Okay, so this is the vaginal ring, just a flexible ring that you just place in your vagina. And then this is the contraceptive patch. Okay, that you place there. Now the injectables. Now the commonest injectable that we have here is the progesterone only contraceptive. That's what a lot of women know about, which is what we call the Depo-Provera, which is 3 monthly. Okay, so you inject it every 3 months, you go and inject, every 3 months you go and inject. But remember, as I said earlier on, the return to fertility can delay for 18 months. So of course, when you want to get pregnant, maybe in a year's time, you probably will have to stop using it now if you are using it, because you know that the return to fertility can take a bit long. Okay, yeah, and of course, some women who use the injectable, they don't bleed at all. They don't have their menses, so it is normal. Some have their menses, even though they are using it. But whatever it is, if you don't have you have your menses regularly, and all of a sudden you realize you're not having it, just make sure you're not pregnant. Okay. Okay. So the side effect is what we call amenorrhea. That means you don't have your menses. All right. For some people, that's even a good thing. All right. They don't lose blood. They don't have to spend money on pads. They are free throughout the whole month. If you have severe pain during your menses, this one will help you. All right, as well. And it's effective up to 99%, very effective. All right, so that's a picture of the Depo-Provera. We have the original, which is also, but this one is a combined injectable. Okay, so this is the most widely used injectable, most widely used Depo-Provera. Okay, look, 14 million people worldwide use it. It's very, very popular. Okay, and you take it every 3 months. Okay, every 3 months you go and take the injection. So it also works by the same mechanism. It suppresses the hormones responsible for ovulation. So that's why I said some women do not ovulate at all. That's why they don't have their menses. And it thickens the cervical mucus, so the sperms can penetrate as well. So that's how it works. And then now we have the implants. Okay, so the implants are also hormonal. Okay, they are hormones. They are also long-acting, reversible. Okay, there are normally some small rods that we insert normally under the skin here. You know, I mean, when you insert something, a lady inserts something here, nobody is likely to see it. Okay, and then it's very tiny. Right, it's inserted under the skin, and then it has its duration of yes, most of it will be about 5 years. That's why we say they are long acting. Now, as soon as you remove it, you can get pregnant. And it's very effective. They are one of the most effective contraceptive methods. Okay. Okay, so this is a picture of this is a popular one. This is what we call Jadelle. It has 2 rods. Okay, Jadelle. It has 2 rods which is inserted under the skin somewhere here. Okay, little snip is made and it's inserted there. All right, and after the years that you are supposed to use it, you go and it's just removed. Okay, and it releases the hormones every day, removes just a bit of it. It releases a bit of hormones every day to protect you. And you can use it for 3 years, all right? You can use it for 3 years. We have Implanon, which can be used for 5 years. That one is a single rod, okay? The Jadelle is 2 rods, this is a single rod. And this can last for as much as 5 years, okay? Yeah, and then also basically the same way of preventing. It thickens the cervical mucus, okay? It suppresses ovulation in about 50% of your cycle. So sometimes you may not have your menses. It's understandable, okay? And it thickens the cervical mucus. And so that is how it works. Now we have what we call the permanent method. Now, remember, when you use this method, it is permanent. We've had so many women who use this method. In fact, this week I've had 2 people call me, Doc, I tied my tube, my last pregnancy. I tied my tube. Now, suddenly my husband wants us to have another child. What can I do? Then the only thing you can do in this case is IVF. Okay, because when you do the permanent method, it is permanent, as we say. Reversal is not, doesn't have very good results. So the permanent method mainly prevents the egg and the sperm from meeting. All right, so it's done surgically. Okay, so we have one that we do on the woman and one we do on the man. Now the one we do on the woman is called the bilateral tuber ligation. Okay, so we normally would do it during a cesarean section. And then the woman who opts for it, the tubes are tied, okay, and then cut. And most of the time, we try as much as possible not to do this for young women. And sometimes the women are young and then they still want to do it, but we always try as much as possible because most of the time they regret it. Maybe they lose a child and now suddenly they want to get pregnant again, or they divorce and they get married again, and then the new husband wants a child, and now you've tied your tubes. But of course, if you're an older woman and you do this, you're not likely to even want to get pregnant again. But when you're a young woman in your 20s or very early 30s and you go and do this, it's sometimes regret comes. So you have to be very, very sure and about it, knowing very well that it's not easily reversible. Okay. And for the man, it's a vasectomy where the vas deferens, the tube that the sperm passes through from the testis, you can see from this picture, from the testis, the sperm passes through the tube and then it enters the penis. Okay, so we do a vasectomy by preventing that from happening. Okay, and then that is how it works. Remember, for the men, when we do vasectomy, you have to use protection for at least 3 months, okay? Because there may be some sperms which are already past where we had, okay, before. And then you have to do a semen test to make sure that there's no more sperms before you can now start having unprotected sex. But most men are worried about vasectomy because they think it affects their potency. It has nothing to do with your potency. It's as you say, it's not castration, okay? You can still have a normal erection and have sex normally. Sometimes the women also don't want their husband to do vasectomy because they feel now the man would be having sex all over the place because he knows he can't impregnate anymore. So vasectomy has very low uptake in most societies, all right? Now, the popular emergency contraception, okay? These are methods of contraception for preventing unplanned pregnancy following unprotected intercourse. So this one, you've already had the sex, okay? And you decide that, no, you may get pregnant. So you take the contraceptive, you get it. So unlike the normal one that's you take it even before sex, this one, you take it after sex. And it doesn't work if you take it before sex. Some ladies sometimes come across, oh, okay, she knows she's going to do something tonight. So she even takes the emergency contraceptive pill even before. Or another common mistake they do is that she has sex and then she takes the emergency contraceptive today. And then she'll have sex again tomorrow, and then tomorrow next, thinking that, oh, I've already taken the emergency contraceptive. You don't take it against future sex, okay? You take it against previous sex. So don't be doing that mistake, all right? It is for sex that has already had, and it's an emergency. If you are taking, when I remember in specialization, one of the professors told us that if a lady are taking emergency contraceptive more than twice in a year, then you should think about a more permanent form of contraception, okay? Right? Because it has a failure rate, it is not perfect, okay? So you should have a more permanent method, and then you have your peace of mind. Very, very important. Now, other reasons why you may take emergency contraceptive, you are raped, all right, or your normal regular form of contraceptive fails, like the condom tore, or the person didn't withdraw and came inside you, or he's not even so sure. And these kind of situations warrant emergency. Or you yourself, you just had unprotected sex, and then you take it. Now, the emergency contraceptive have a time limit. Okay, I remember those days at the emergency Kolebu, a girl will come. And then she's pregnant. She said she took emergency contraceptive. She doesn't know why she got pregnant. And you realize that she took the emergency contraceptive a week after the unprotected sex, or several days after the unprotected sex. it is going to fail, all right? It is best taking the morning after sex. That's why we call it morning after pill. That is your best bet. You know that you did something, you're worried you get pregnant, go and buy it and take it. The common one we know, Postinone 2. Take it has 2 tablets in it. It says take 1 12 hours apart. You can take all the 2 at the same time. It doesn't matter. Sometimes just because of the side effects. If you take it and you vomit immediately within an hour to 2, you have to repeat it again. Okay? And it works best if taken within 2 days, 48 hours, that's 3 days. The popular one we know, that's the Postinone 2 or the Lydia emergency contraceptive. It's more effective if you take it within 48 hours. The earlier, the better, okay? After 48 hours, it doesn't really work so much. We have other types like the Ellipse, crystal acetate, and then the copper, the IUD. The IUD, as I said, is the best from that one. You can use it up to 5 days of unprotected sex. You can use it up to 5 days. It will still work very well for you, all right? The crystal acetate can also work up to 5 days of unprotected sex. But you see, the emergency contraceptive, they work by preventing ovulation, especially the popular Postinone 2. But if you have already ovulated before you take it to its possibility of working is lower because you have already ovulated, okay? But with the IUD, even if you have ovulated, it will still protect you from pregnancy. I hope I understood this fact about emergency contraceptive very, very well. So how do they work? They delay or inhibit ovulation. Do you get to delay or inhibit ovulation? But when the ovulation has happened already, it becomes very difficult. They prevent implantation. That's mainly the IUD, okay? And it affects the cervical mucus and affects sperm transport. It does not cause abortion, remember, it doesn't cause abortion. And the copper IUD is 99% effective, all right? If you use an emergency contraceptive, now that's one of the biggest problems. And then now your menses is not coming. Then you are in so much trouble, you're thinking, you're worried. But if your period delays for more than 1 week, please do a pregnancy test to exclude pregnancy, because as I said, it is not 100% effective. So we have the natural methods, natural family planning methods. Okay, we have the abstinence during the fertile phase, lactation, amenorrhea, and the withdrawal method. These are very important for certain religious groups because they don't want to use any contraceptive method, so they use the natural methods. Okay, so let me talk about the first one, the lactation, amenorrhea method. That's for the breastfeeding mother. Okay, of course, for this method to work, 3 conditions must be fully fulfilled. 1, your monthly bleeding hasn't started. So far as your monthly bleeding has started, this is not working for you anymore. The baby is fully breastfeeding, all right? So if your baby is not fully breastfeeding, your baby has started eating other food, lactogen and all those things, milk and stuff, it won't work for you. And the baby, of course, has to be less than 6 months, okay? And it works because so far as they are fully breastfeeding, you produce a hormone called prolactin, which suppresses ovulation, all right? So it prevents you from ovulating. But remember, you have to satisfy these conditions for this to work for you. Now we have the natural ones, okay, which I will talk about. So these are mainly using what we call the safe periods, okay, safe period. So you can use this either to get pregnant or to prevent pregnancy if you have an idea of this, okay. And normally these ones work for people who have a regular cycle. Your cycle is regular. Some people irregular, and it has to be the average 28-day cycle or 26 to 32 days. It has to fall within that range for this to work for you. And for such women who have a regular 28-day cycle, their fertile days are from day 8 to 19. Now, what do I mean from day 8? The day your menses come is day 1. Now listen to this carefully, because this, you can use it to get pregnant or prevent pregnancy. The day your menses come or start is day 1. All right, that's what we call day 1. Now, for a natural cycle, a regular cycle, I expect that day 14 is when you ovulate. Okay, and then day 28, your menses starts again if you don't get pregnant. Now, there are certain things that we have to know. That the sperm can survive in the woman's body for 5 days. You get it? The sperm can survive for 5 days. Those sperm, don't joke with them. All right, it can survive for 5 days. So if you would ovulate on day 14, all right, and you have sex on day 10, and the sperm can survive for what? 5 days, what do you expect will happen? It will wait for you to ovulate. So the ladies always do this mistake. Oh, I'm ovulating on day 14, so I'm safe today. Let's do it. The sperms will wait. They are very patient. They'll swim and they'll be in the tube waiting. All right. So knowing that effect, you should avoid sex from day 8. All right. So that if you even have sex on day 9, the sperms are waiting for their 5 days and you get pregnant. Now, when the woman ovulates on day 14, the sperm, the egg would stay in her body for about 48 hours. Okay, so she ovulates on day 14. Day 15, 16, 17, the egg is still alive, all right? It's still there, it can still be fertilized. Okay, sometimes she may not even ovulate on day 14. Maybe, things happen. She may ovulate on day 15, it may extend a little, 15 or 16, all right? And so between day 8 and 19, the woman is fertile. So avoid sex on those days. Now, for the couple who wants to get pregnant, that is when you should have sex almost every day. Okay, those are the days you should have sex the most. So if you and your partner don't live in the same region, you're in Koforidua, you're a teacher, your partner is in the whole, a teacher, you are trying to get pregnant, and then the time you visit your partner is after day 19. That sex is just for fun. You are not getting pregnant, or before day 8, it's just for fun. Schedule your visits appropriately. So this is mainly the standard days method using the cycle. Okay. And then we have so I think that's the main one. We have the cervical mucus method, where the woman will be checking your cervical mucus every time. All right. And when you notice that your cervical mucus, your vaginal, the discharge is more and it's slimy like okra, all right, it means you are fertile, so you avoid sex on those days. If you want to get pregnant, you have more sex on those days, okay? And then these ones are not popular, so let me know. So thank you very much. I'm sure I have tackled all the important ones. As I said, I can't tackle every single one, but for the very important ones, I tried to talk about them. So I've covered all the methods of family planning, giving you the various side effects. I hope you have enjoyed the presentation and have learned a lot. Thank you very much. Over to you, Dr. Albert.
Thank you very much, Dr. Parker. That was very extensive. He covered all grounds, everything that every one of us needs to know about family planning methods. He's taking his time to cover it all. At this point, the floor is open. If you have any questions, you feel free to put in the chat box or in the comment section, and Dr. Parker will gladly answer you. Feel free to put your questions in the chat box. But before we start, I have some questions in the chat box already pending. Please, I wanted to know if you are in your free period and you have unwanted sex, are you going to be pregnant, please?
I think this is just the last thing I spoke about. So I think I've answered that question already.
Yes, most of it has been answered. That's why I said you hold off. When he's done, then you ask your questions. Somebody is also asking, please, does it mean we ovulate without menstruating when breastfeeding?
What I said is that the first menses you had, you've ovulated prior to that menses coming. For a woman to have a menses, she must have ovulated. Do you get it? You ovulate 2 weeks before you have your menses. So the first menses a breastfeeding mother had it means she has ovulated 2 weeks ago. So if she had sex those times, she could get pregnant. Yeah.
Somebody's asking, I start menstruating exactly a month after delivery. Is it normal?
Yeah, it can happen in some women. So far as you're not breastfeeding actively or your prolactin level is not high enough, you start having your menses. So for such a woman, she can take the progesterone only contraceptive pill.
All right. So there's somebody who says, I've been on implants for 2 years and it's been okay. My only problem is I can bleed non-stop for 2 months and I have to take paracetamol for 1 week before it stops. And I also have low sex drive with contraceptive. What would you advise, Doc?
Yeah, so I mean, definitely your method may have to change. First, you see the bleeding, we have ways of the irregular bleeding, we have ways of treating them, okay, medications for treating the irregular bleeding. They are expected in some of these contraceptives and you treat it. So you may have to go to the place you did your family planning and report it to them. All right. Of course, if it's giving low sex drive, then probably it will have to be changed to another one so that you still have your sex drive.
All right, thank you very much. Please keep your questions coming. Dr. Parker is ready to answer them. Send them. Okay. Which method is best for women with a history of fibroids?
Well, a woman with a fibroid can use any method at all. Okay, but when they are bleeding heavily because of the fibroid, I talk about the non-contraceptive benefit of the hormonal ones. Okay, so she can use that. That is especially if she's not ready to get pregnant. Okay, you can use the Depo-Provera, which is very good. It helps stop the bleeding. If they are bleeding a lot. Okay, yeah, but you have to know that the return to fertility with some of them will be not like the Depo-Provera, but that's one of the best ones if you are not planning to get pregnant anytime soon and you bleed a lot. And most of the other hormonal ones regulate the bleeding and help reduce the bleeding.
Okay, somebody's also asking which one is good for irregular menses?
Yeah, it's also the hormonal ones. All right. I talked about it through the slide that the hormonal ones are very good for irregular menses because they help regulate, we use it to regulate your menses through the non-contraceptive benefits.
Okay, somebody is asking, is it true that breastfeeding moms cannot take the monthly one, the Norgino?
Breast what?
The breastfeeding mothers cannot take the monthly.
Breastfeeding mothers, we don't give them the combined ones. We don't give them combined one. We give them progesterone only pills.
Yeah. Okay. Did you say when you are ovulating and you use a contraceptive, your chances of getting pregnant is higher?
When you are what?
Ovulating and you use a contraceptive, your chances of getting pregnant is higher. Is that what you said?
I don't care what the person is talking about. What I said, I don't know if she's talking about the emergency contraceptive. The emergency contraceptives work by preventing ovulation. All right. So their effectiveness is reduced if you've already ovulated when you use it, except the IUD, which would work best even if you have ovulated, because that will prevent implantation.
All right. So somebody asked, does Depo make you fat?
Yeah, this is the question I was expecting the whole time. In fact, what we even realize is that a lot of women actually take Depo because they want to get fat. So that's why they go and take the Depo, not even because of the contraceptive benefits. All right. No, there are a group of women that take Depo and they gain weight. All right. The progesterone only contraceptive, that is some of the side effects that some people use it and they gain weight when they use it, but not everybody. All right. So when you realize that you are gaining weight, you stop it. But they also have good benefits in helping prevent acne as well. But when you use it and realize you are gaining weight, then you would have to stop it. because that's a side effect that quite a number of women experience. Even though for most Ghanaian women, to them, that's even a good news for them because they want accoutrements. Okay.
Are you safe to have unprotected sex after 3 days of ovulation and it will result into pregnancy?
Are you safe to have what, unprotected sex after
3 days of ovulation?
Yeah, so I explained that the egg, when a woman ovulates, the egg can stay in the body for at least 48 hours. So I said clearly, day 8 to day 19 is your fertile period. Do not have unprotected sex if you do not want to get pregnant. If you want to get pregnant, then those are the best times to have unprotected sex.
All right. Is the vaginal ring and the skin patches, are they available in Ghana?
Yeah, the best place you would get those ones are the family planning unit of Korle Bu.
All right. So if you want more of the methods, all of them, those that he has described, you can visit the family planning unit of Korle Bu Teaching Hospital and you will be counseled appropriately. You know which one is best for you and all the methods that you wish for. Somebody is asking, what's the difference in texture between ovulation mucus, vaginal fluid, that's the normal vaginal fluid, and vaginal infection?
So the way of ovulating, the secretion is ochre-like. It's slimy and it can stretch. All right, like ochre. That is it. It's very slimy and it stretches like ochre. That is how you know it. Of course, if you're having vaginal infection, it is offensive. The ovulation one is normally clear. If you're having an infection, it will be creamish or greenish, brownish. There's offensive smell, but you have a lot of itching too as well. Okay. Yeah.
All right. How do people with irregular period prevent pregnancy or achieve pregnancy if they do not know their fertile days?
Yeah, so if you have irregular periods, it's best, you see, normally when you have irregular period, you may be having what we call anovulatory cycle. You may not be ovulating if your periods are very irregular, because when you're ovulating, at least what we call the second half of your cycle is always fixed, always fixed 14 days. So mostly if you are having regular, you may probably be having what we call anovulatory cycle. It's best to see a gynecologist to assess you, to do certain tests to see if you are really ovulating. If you are not ovulating, then we will stimulate you to ovulate so that you can get pregnant.
Okay, someone says she's been on IUD for 5 years. Are there any gynae complications?
No. IUD can use it as much as 10, 12 years. As I said, there are no complications with it. The problem is if you are, we normally don't like ladies who are very promiscuous to be using IUD because of the chances of infection. Because when you have infection and use IUD, it's not safe, all right? So when you're using IUD and you realize that you're having a lot of vaginal infection, or you're having, you have a high risk partner, or you yourself, you have a high risk behavior, then it's not safe for you, right?
Please, when you go for the IUDs, when does it start to function?
When does it start to function?
Yes.
Yeah, normally after 24 hours, you are safe with it. But of course, the copper IUD will start functioning immediately because it's even used as an emergency contraceptive. But the hormonal one, normally after 24 hours, because as I said, it's releasing daily doses of the contraceptive and the level of progesterone. So within that time, if you want to have sex, it's best to use a backup like a condom or use the pills.
Okay, somebody wants to know what is the side effects of regularly using emergency contraceptive pill after each unprotected sex, rather than going for a regular family planning method?
So, I mean, most ladies who use it, you realize that it disrupts your cycle, all right? That your cycle becomes it becomes unpredictable. Your menses may delay or it may come earlier than you expect it. All right. So this is mainly the problem that it may give you. Apart from that, there is no other problem, but it will just disrupt your cycle. And you know, when you take that one tablet of IUD, it's high dose. So it's like you're taking 21 pills of Secure and swallowed it at the same time. So they're using very high dose of the hormones. All right. So you may have some irregular bleeding and with it. And most women don't like that, having irregular bleeding or that. You can't predict your cycle anymore. Most women will not like that. You want to be able to predict your cycle, but the emergency contraceptive may just mess up your cycle, you know. But it doesn't prevent future pregnancy. Some women are worried that it may prevent future pregnancy. But as much as possible, if you are using IUD too often, it's not good. Just get a permanent form of contraception. And it has a failure rate as well. As I said, it has a failure rate. It is not 100%. Most often, if you are using it and you've already ovulated, it may not work, but you don't know if you've already ovulated. It is best if you've not ovulated, but if you've already ovulated, the efficacy reduces as well.
All right. Somebody's asking, is it okay? Is it normal to not menstruate for about 18 months after delivery?
18 months is too long. So far as, of course, baby would have started eating so long ago. It's not normal. All right, you have to see a gynecologist to be assessed and find out the reason why I'm not menstruating so that they are treated.
A sister of mine did Implanon and removed it after 2 years, but for 2 years now, after that she removed it, she can't conceive again. What would you advise?
So you see, this is one thing we should know. The fact that she can't conceive is not because of the Implanon. You know, that's the misconceptions people have, that family planning prevents pregnancy. It doesn't. All right. The fact that she can't conceive, if it was a Depo-Provera, that why I said that return to fertility can be long. All right, it can take a long time. So that is understandable. But 2 years is even longer. But if she can't conceive with Implanon, she may be having infertility due to some other reason and not because she used the Implanon. Because the Implanon releases the hormone daily, little amount. When you remove it, it stops releasing that hormone. So there's no reason why you shouldn't be able to conceive. So there may be other reasons why she may not be conceived. We talked about infertility before. There's a video of infertility on the channel you can watch. It could be a male factor infertility. It could be she having other issues why she's not getting pregnant. So she should see a gynecologist and be well assessed to find out the reason.
Yes, like Dr. Parker said, he's had a lot of such sessions on infertility, on fibroid, on cyst. All of them are on the channel. So if you have not subscribed yet, so feel free to subscribe and you have access to all of that. We continue. Does one have to check his blood group? Does one have to check their blood group before using any of the methods?
No, not at all. The method has got nothing to do with blood group. Anybody can use it. It doesn't have anything to do with blood group at all.
Good. I'm a bit on the plus size side and worried about gaining more weight. Which option will favor me more? I react to latest condoms.
Yeah, so it is not easy to just tell you which method to use. Normally, before we even choose a contraceptive method for a person, we do what we call counseling, okay, where we talk about it. And then we have to do something called medical eligibility criteria, see which one will be best for you. Maybe you have some illness or medical conditions. When you say you're already on the high side, normally we are worried with giving the combined pills to these people. So you have to have counseling and then be able to choose the appropriate one for you. I don't know about your future fertility wishes, you know, how soon you want to get pregnant, today, you go for the long-acting reversible, you know, those all matter to be able to help you to make a decision. You get it, yeah. But IUD is always a good option for the later you told me. IUD is always a good option, depending on how soon you want to get pregnant.
With the permanent method, can the woman get pregnant again if she tries IVF?
Yeah, so that's your only option for the woman if she has done tubal ligation. Your tubes have been cut, or a woman who has had ectopic and both tubes have been cut. The sperm and the egg cannot meet. So the only option is IVF because her eggs are still there. She's still ovulating. So we can harvest her eggs, take the husband's sperms, and then use it for IVF for her. Her womb is still there, which is the important thing that we need, all right? And so it is possible. As I said, a lady contacted me somewhere last month. She did BTL, and then now she's remarried, and the husband wants to have kids, all right? So we are doing IVF for her currently, because that's the only option right now.
Which of the contraceptives can improve or increase a woman's fertility?
We don't have any contraceptive that would improve or increase a woman's fertility. The contraceptive is to prevent pregnancy. When we are talking about boosting a woman's fertility or stimulating her, we have special drugs we use for that, other than contraceptive drugs.
Okay, somebody is asking a question. So a breastfeeding mother didn't menstruate for 17 months, but 2 weeks after weaning her baby, she started to menstruate. She's asking, is it okay?
She didn't menstruate for how long?
17 months, but 2 weeks after weaning the child, she began to menstruate.
Yeah, 17 months is quite long anyway, but so far as she started menstruating, that's fine. It depends on how she was breastfeeding the baby too, But so far as you're breastfeeding a baby and your level of prolactin is high, it prevents ovulation, and that is why you will not have your menses. But of course, 17 months is excessive. But so far as she's ovulating, that's fine.
If you're on depot for 3 months and you stop, after how many months will you get pregnant?
Nobody can tell. But as I said, the return to fertility with depot can be as long as 18 months. So if you're a woman and you plan to get pregnant again within a specific period, be careful when you're taking depot. Because if you want to get pregnant next year, and then you go and take depot injections this year, you should know that you may not get pregnant next year because return to fertility can be as long as 18 months. It doesn't mean it happens to every woman. For some women, they can get pregnant immediately. But for some, it can take as long as that length before they start ovulating.
Somebody is asking, Doc, please, how do you know your safe and unsafe period? These people join late. So for those of us who are joining us late, so you don't take us too back, the recording will be posted on the YouTube channel so you can go and play back and listen and learn everything so that we don't take everybody back. But somebody is asking, how do you know your safe and unsafe period?
Oh, yeah. So please, I think you should watch the YouTube channel. Yes. I explained that into details, yes, so that you would understand very well.
Somebody say, I had an ectopic pregnancy 2 years ago and still not able to conceive. What can I possibly do?
Yeah, so you see, if you had an ectopic pregnancy, it means that the ectopic pregnancy happened on was damaged. It was probably blocked by maybe some pelvic inflammatory disease that we had in the past due to vaginal infection, which was probably not well treated. So the tube was blocked. Now, remember, whatever happens to one tube is likely to have happened to the other tube. Do you get it? So the other tube may also be blocked, and that is why you are not getting pregnant. So the best is for you to see a gynecologist to assess if the other tube is patent or is blocked, and then we know what we do from there.
All right, thank you very much. Those of us joining us late, I've posted a YouTube link again in the chat box. Please subscribe. I'll be posting the recording shortly after we end so that you can enjoy all the session. Dr. Parker took his time and went through all the different methods, so we don't want to keep going back to those of us who joined us late. There's a lot of information he has shared freely. Just make some few minutes and go listen, and you'll be glad you did. Somebody is asking, is the regular use of contraceptive, oral contraceptive, does it have any effects on the unborn child?
No. There's no teratogenic effect. It doesn't have any effect at all.
All right, Ephraim Agbo, I hope you've been answered. It doesn't have any effect on your conception of the unborn child. Somebody is asking, I have one child already and I'll be 47 years this month. Is it possible for me to give birth again?
Of course, your chances of giving birth are quite low at 47. You're almost getting to your menopausal age. It depends on how bad you want to have a child. But if you really, really want to have a child, you may want to see a gynecologist who runs a fertility center. So you can call me or you can WhatsApp me in that case, because your chances of getting pregnant naturally is very, very reduced. We have to definitely intervene and do something to give you a better chance. Yeah.
All right. If after tubal ligation, very, very interesting question, Dr. Parker, this is how it goes. If after tubal ligation, the only option is IVF that can help you become pregnant, which channel does the egg pass through before menstruation occurs, please?
Which channel does the egg pass through? Before what?
Menstruation.
Oh, the tube is not needed for menstruation to happen. The tube has got absolutely nothing to do with menstruation. Menstruation is all got to do with hormones. Hormones are in the blood, okay? So far as you have ovaries, which releases estrogen, the estrogen is released into the bloodstream, and the hormone acts on the womb, all right, to build it up every month. And when you don't get pregnant, it is shed out as menstruation. The egg doesn't have to pass through the tube to enter the womb for you to menstruate. It has absolutely nothing to do with menstruation. Okay, yeah.
All right, thank you very much. If you have any other questions, those who joined us late, please, we advise that you wait and listen to the whole presentation on the YouTube channel. It will be shared immediately after we close from here. I'll share a few minutes. I'll just quickly put it back on the channel. I've shared a channel link in the comment section. Click on it, put the notification buttons on. Thank you all very much. And somebody is asking another question, which I think will take us back. It's about safe period, unsafe period. Dr. Parker took his time to explain all that. Now, if there's any other question, I have two questions to ask Dr. Parker as a form of summary. If there's any other question, please feel free to put in the chat box. If you join us late and you are not so sure what is going on, please kindly hold off and then just subscribe to the channel and the recording will be made available to you. Dr. Parker took his time. You don't get this on any channel that I've been watching. You don't get this regularly. Detailed approach, detailed explanation about the different methods and in-depth explanations. It's quite not out there like that. So make time, few minutes, watch the recording. And if you have any questions, Dr. Parker's line, he'll make it available. He has a lot of private clients. If you want to see him privately, of course, that is not going to be free. You want to see him privately, you get him a call, you chat him on WhatsApp, and he'll be more than glad to be of help to you. Okay, so somebody is asking a very interesting question again. What happens to the eggs after BTL has been done?
Yeah, so nothing happens to them. The woman ovulates, but normally when the tubes are there, when a woman ovulates, the egg is captured. The egg is small. You can't even see it with your naked eyes. It is a small cell. You need a high-powered microscope to see the egg. All right. So normally the tube is there. When a woman ovulates, it is captured by the tube. All right, and it passes into the tube and meets the distance. But of course, if the tube is not there, the egg is ovulated. It falls anywhere in the peritoneal or abdominal cavity. All right, and that's what happens. It is a small thing. You can't see it with the naked eye.
All right. Now, somebody is also asking which of the methods won't make me fat. Again, Dr. Parker took his time to explain all the methods. So, again, it's individualistic. You listen to the presentation, then you can go sit down with a counselor at the reproductive units or the family planning unit, and they will find you your best fit. He started by saying there is no ideal contraceptive. There is none which is 100% as we all expect it to be. If you watch from the beginning, you will get all those details. All right. Somebody is asking, does age matter when you go in for implanon?
No. Age does not matter. You can take it. It has nothing to do with age. So far as you are still menstruating, you can get pregnant. So it has nothing to do with age.
All right, thank you very much. We are far behind time. I appreciate Dr. Parker for making it, but I have two questions. You've answered them already, but it's a concern for a lot of people. So I just wanted to touch on those again. Let me see if there's a question again. Okay, let me just take it. There's somebody wants to know, when should a woman begin to menstruate after delivery, and when should it be a concern when she's not menstruating?
So there's no fixed time, but so far as you are breastfeeding and the baby is not on baby food, that means exclusive breastfeeding, including night time, your prolactin level will still be high and you're not likely to menstruate. But of course, for women from 4 months to 6 months, they start adding baby food. Okay, so from 6 months, you should expect your menses should come, because definitely from 6 months, you shouldn't be on exclusive breastfeeding. You should add other food to baby's diet. Okay, but if you've done that and your menses is still not coming, then you definitely should see a gynecologist then.
All right, somebody is asking, if you have your menses for 3 days, is it normal?
Yeah, it's normal. The normal duration of a menstrual cycle is anything from 2 to 7 days. Okay, 80 mils of fluid is the average. 80 mils. 80 mils is like 4 tablespoons. So the women who always say, "Doctor, my menses is not coming, it's just small." 80 mils is the average. Take 4 tablespoons. That is the average menstrual flow for the whole duration of your menses.
All right, thank you very much. Dr. Parker, 2 main concerns that a lot of people have interest in. The first one is the permanent contraceptive methods. A lot of people go in for it, and after they remarry or they are interested in having more kids, then they are surprised as to what we actually mean by it's permanent. What advice generally will you give anyone before they consider any of the permanent methods, vasectomy or bilateral tubal ligation or any other permanent methods? What advice will you give them?
Yeah, so as I said during the presentation, the permanent methods are permanent. All right, permanent. Its reversal is very difficult, and the success rate is very, very, very low. So most doctors will not even attempt to do it, because, as I said, it's very difficult, and failure, the success rate is extremely low. So you have to be very sure of it. Now, the common one is the BTL, and normally women, they have 4 kids. They have 5, even 5. A woman can have 5 kids. But you see, with that one, it is not, sometimes it's not even about the number of kids you have. It's about the woman's age. Do you get it? The woman's age is the most important factor when it comes to that. Because you have 5 kids, because you started early. If you started giving birth at 22 or 24, you married early. So by 32, you already have 4 kids. So you feel you're done, but you're still young. There is always a possibility of divorce. And there's always a possibility of remarrying with a partner who will you now want to have kids with a partner. And as I say, it happens a lot. So it comes with a lot of regrets. Okay, so you should think carefully about it. It shouldn't be the moment you're in love, you know you're married forever. We all know things happen. Sometimes couples will lose a child, maybe you have some 3 children, and anything can happen. You know, you lose the kids, and then all of a sudden you want to get pregnant. Okay. But if a woman is older, in her 40s, I mean, the probability of she, wanting a child again, even if she remarries after 45, it's very, very low. It's extremely low. Okay, so then it is more ideal, and we consider it. But hardly do we want to consider BT of a woman who is very young. All right, so you should think carefully about it before you do the best bet at that age is, remember, there is what we call long-acting reversible, which can also last you for 10, 12 years. The copper is only they are 32 and you have 4 kids, you think you are finished. But as I said, things can happen. You have the option of taking the long-acting reversible, something that will last 10 years. You get it? So if anything happens, please, you can take it off. And that one too is very, very effective. All right. So those are the things to consider. As for vasectomy, men hardly do it. So we don't have a lot of problems with it. But the only misconception about it is that men feel when they do it, they become impotent. It is not castration. The testis is there. It is not touched. All right. It is just the tube that the sperm pass through that has been cut. So the sperms can pass through it. That's the only disadvantage, the only problem with it. That's what is done actually. So there's no problem with having an erection. You still have a normal erection and everything. When you have sex, you still release, you still ejaculate. Okay, but the ejaculate won't contain sperms. It will contain fluid from the other glands like the prostate glands and the seminal vesicle. Those ones should be there, but there's no sperm because the testis is still there, but the connection from the testis to the penis has been cut. So you still ejaculate normally. Fluid will come, you still come normally. All right. So those are the important things to know. It doesn't affect the man's potency, sexual potency at all.
All right, now to the next one, which I want to just make a general advice to everybody, because a lot of people have questions on it. It's about emergency contraceptive pills or emergency contraception. Give us reasons why sometimes it fails and what to consider, which is the best preferred.
It fails because, one, the lady doesn't use it when she's supposed to use it. She would wait for more than 3 days, sometimes more than 5 days, and then she goes to take it. I see it a lot. Sometimes I wonder why they do that. Every week I get a lady calling me, and doctor, I had sex last week. Can I take the emergency contraceptive now? They just delay it too much. All right. The normal one, the Lydia or the Postinol 2, it is most effective when used within 3 days. Okay. 5 days or 120 hours is best for IUD and ulipristal acid. That one is hardly in Ghana. Okay, you hardly find that one in Ghana. I don't know about the big pharmacy, but I've called a number of pharmacies once a while looking for some. I don't get it. The IUD can last up to 5 days or 120 hours. All right, so taking it later after its effectiveness is not going to work anymore. It's one of the commonest reasons it fails. And of course, sometimes the lady takes it and she vomits and she doesn't take it again because it causes nausea and vomiting. If you take it within an hour, you vomit, you have to take it again, you have to repeat it again, it will fail. Now, other ladies try to be smart. They take it against future sex. So I'm going to have sex tomorrow, so let me take the emergency contraceptive. Or they had sex yesterday evening and they took it today. And then they will have sex this evening and tomorrow, and they believe they've taken it already. So it's still, it's working against future sex. No, you have to repeat it again. All right. And of course, sometimes you even take it when you're supposed to take, but remember, it doesn't prevent ovulation. It delays ovulation. It delays ovulation or inhibits ovulation. Sorry. It delays or inhibits ovulation. But if ovulation has already occurred, it may not work because ovulation has occurred already. Okay, so it may not work except the IUD. But of course, the IUD is not the popular form of emergency contraceptive here. In fact, a lot of ladies don't know it's an emergency contraceptive. And of course, that one, you can't just go into a pharmacy and get it and take it. You have to go to a hospital. You have to have a professional who knows how to insert it. and that's why it can be used. In the developed world, like the UK, the emergency contraceptives are free. All right, you walk into a pharmacy shop and you get the emergency contraceptive. You don't pay anything for it. All right, but over here you need money. So sometimes the person doesn't have money to buy it, so they may not buy it, or they wait till they get money. You wait till the guy sends you money, before you go and buy it. And by then it is way past the time. So these are the common reasons why it fails.
All right, thank you very much. It's been a long time. We appreciate the detailed presentation, the in-depth explanation. We appreciate so much. Thank you very much. Please, everyone on the call, join me. Say a special thank you to Dr. Parker, Senior Obstetrician Gynecologist, and he's available for anyone who wants a private consultation. Dr. Parker, if you don't mind, you can maybe share your contact details for those who want to reach you for private discussions. Yes, he's available to help anyone who wants private consultation. He's available. Pick his contacts, and if you have any question after listening or watching the recorded version, please put it in the chat comment section. You can pick my number from the channel description and send me a private message on WhatsApp, and we can always be of help to you. Thank you very much for making time and sticking and staying with us. It's been quite a long time. Yes, I know that 1 hour, but it's been very fruitful and it's been very in-depth. Thank you very much, Dr. Parker. Once again, we appreciate you and we appreciate your sacrifice. Thank you very much. And to every one of you, thank you for making time. Till I come your way again, please remain safe and let's keep